and hyperkalemia. And these medications is what? Contraindicated for our patients who have what? Nephrodysfunction or may mga renal failures, congestive heart failures, as well as patients who are pregnant. Okay, this medication should not be given to them because this is still categorized as category D. Okay, for there's a high risk for tawag nito, fetal problems as well as maternal problems if they are going to take this A2 receptor blockers. Okay. So what are the things that you have to consider if you're going to give this medication to your patient? Okay, number one, ensure that the patient is not pregnant or she is not lactating and planning to get pregnant. Okay, because we don't want to have problems between the mom and the baby. Okay, this should be taken without regards to food. Okay, so pwede daw siya immune whether you are already eating or on an empty stomach. Okay, there will be no problems with the absorption of the medicine. Okay, monitor your patient's vital signs regularly. Okay, not only A2 receptor blockers, but even on all forms of medications. Once you administer it to your patients, make sure to what? Recheck your patients for any signs of side effects. Okay, and make sure that your patient's serum electrolyte, most especially your potassium, is well monitored. Okay, because what? Our ARBs, okay? ARBs mo ni ato ang abbreviation sa atong angiotensin receptor blocker. Our ARBs already decrease our potassium excretion. So, kung ganon, pwede magkaroon ng hyperkalemia ang ating patient. Okay? That's why it is important, okay, that our patient potassium level should be monitored and your patient is not taking any potassium supplements. Okay? Kasi nga, we don't want our patient to result having hyperkalemia. Okay? So, another form of medication is what we call calcium channel blockers. Kadali lang, class, ha? Give me 2 minutes. 2 minutes lang. Sorry lang. Okay. Our calcium channel blockers. So what these calcium channel blockers do? They prevent the movement of calcium ions in our myocardium and vascular smooth muscles. Okay? Remember that your calcium normally, okay, increases muscle contractility and peripheral resistance, especially in increasing our blood pressure. But, okay, our calcium blockers will block its function. Kaya nga naman, if there will be what? Overproduction of our calcium in the body, what happens is your heart, especially your heart, will double its work. Okay? Mag-overload ang imuhang heart. As a result, you will have tachycardia. Okay? And then, we don't want to overwork our because, of course, we don't want na ma-stress ang atong heart because later on, it will relate to certain disease. Okay, and then these calcium blockers are also used, okay, for patients who have what? Hypertension, patients who are experiencing angina or chest pain, and for patients who have atrial fibrillation. Okay, yung mga arrhythmia natin. Okay, also these doctors, our doctors is giving these calcium channel blockers for patients who have blood vessel conditions. Unsa man yung mga blood vessel conditions na ginaano sa ato ang calcium blockers. These are for patients who have Raynaud's disease. Ma'am, unsa ning Raynaud's disease? This is caused by the smaller arteries that supplies the blood, okay, blood flow in the skin and narrow in response to your tawag ani kanang pag-stress ganito or bugnaw gani kaayo. Okay, so kaning Raynaud's disease, okay, this is triggered if your patient is stressed, okay, and then na anxious imong patients. So as a result, there will be temporary spasm. Okay, there is temporary spasm that blocks the flow of your blood in the body. That is what you call Raynaud's disease. Okay, so ginabigay yung mga calcium blockers doon sa yung mga na-mention ko na uses niya as well as Raynaud's disease. Okay, so our calcium channel blockers has two major categories. So what are these two major categories of our calcium channel blockers? We have non-dihydroxypyridines and dihydropyridines. Okay? So, ano daw itong mga non-dihydropyridines? So, these are medications that inhibits the effect of our sinoatrial and atrioventricular nodes in the heart. Okay, the SA and AV nodes of our heart. Okay, as a result, okay, our cardiac conduction and contractility is getting slower. Okay? Kasi nga, they inhibit the effect of your SA and AV node, resulting to a more slower cardiac contractility and conduction. Okay? And this allows, okay, this allows for the treatment as well of your hypertension and then the reduced oxygen demand. Okay? So, it could help what? It could help control your tachydysarrhythmias. Okay? Ito yung ating mga dihydropyridines. Okay? So, example of this which is very potent and lagi mong makita kapag sa hospital is your verapamil. Okay? We also have diltiazem. Okay? Those are the calcium channel blockers under non-dihydropyridines. Okay? Which interferes the effect of your SA and AV nodes. Okay? So ano 'yon? Pag ang SA and AV nodes ang yang i-interfere, there will be a slower, okay, slower cardiac contractility and conduction. Okay? Mas humihina yung movement or ang work ng iyong heart kapag meron tayong mga calcium channel blockers, especially if it is a non-hydropyridines type of category. Okay? What about dihydropyridines? What are these medications? These dihydropyridines, okay, ito yung mga pine-pine. Ito yung mas common natin nakikita na mga medications or maintenance din ng ating mga parents. Okay? Labaw na ning amlodipine. Okay? Kaning amlodipine, okay, or dihydropyridines, these are the therapeutic doses. Okay? These are the type of therapeutic doses that has what? Little but direct effect, okay, on your myocardium. Okay? And instead, Okay, and instead it becomes a peripheral vasodilator. Okay, it is mostly useful for patients who have hypertension, patients who are also experiencing post-intracranial hemorrhage, and okay, post-intracranial hemorrhage that is what is this associated with vasospasm, and for patients who have migraines. Okay? So, ito yung mga dihydropyridines natin. Yung mga pine. Okay? So, what are the side effects of these medications? Of course, we have your headache, your dizziness, hypotension, syncope, reflex tachycardia, your constipation, AV block, bradycardia, and peripheral edema. Okay, so what will be now your nursing consideration for a patient taking calcium channel blocker? You have to regularly monitor your ECG, cardiac rate, and BP. Okay, kasi nga, we want to make sure that your patients will not have any calcium channel blocker toxicity. Okay? Especially kaning ECG, kailangan din nato i-monitor sa atong patient kasi nga di ba ang iyang effect is ipa-slow down niya ang contractility sa imong heart. So now, if the contractility of your heart becomes slow, tendency is basi magkadayon-dayon magbradycardia imong patient. Okay? And then we don't want na moabot sa point na mag-relax ang iyang heart, and it will be what? It will it will cause patient's death. Okay? That's why we have to really check the ECG and the cardiac rate of your patient. Okay? Always have an e-card available with IV administration. Kasi nga, chances of patients acquiring bradycardia is very high. And we don't want our patients to have what? Kanang irreversible bradycardia. So we have to give them our antidotes, okay, for that. And it's all in our emergency card. And later on, we will be discussing all the emergency medications that we are going to use for emergency situations. Okay? And then, for instance, your patient has peripheral edema. Peripheral, dili lang kay angioedema. Kunyari, merong lower extremity na edema imong patient. So, we are going to perform mga postural drainage positioning. Okay, like elevating of your legs or your limbs that has edema. Okay, protect the drug from light and moisture because we don't want to disintegrate, okay, the potency of your medication. So, proper storage is really required. Okay. You have to increase OFI and high fiber diet on your patient. Not only for patients taking calcium channel blockers, but to all patients. Okay, we have, if it's not contraindicated for them to increase their OFI, encourage your patient to have increased OFI. So what? There will be excretion of what? Excretion of those medications that they have taken. Okay, and then avoid overexertion when anginal pain is relieved. Okay, kaning mga usahay no, kaning ato ang mga elderly sport, ganing kung kinsa pa ang mas mga may edad go upa to ragahi og ulo. Okay, imong ingnan kay na okay na sila, wala na nagsakit ilang dughan, magsige na pud og lihok-lihok kanang dili gani mahimutang. Okay, so encourage them once they are what? Stable already. Encourage them to have what? Complete bed rest. Okay, ayaw po ng complete bed rest without bathroom privileges. Lahi na po na. Okay, just tell them na try to relax for some time para mas faster ang recovery sa ating mga patients. Okay, so if your patient is experiencing headache, you can advise them to give what? Or you can give them paracetamol to treat for the headache. Okay, and then unlike all other medications, our calcium channel blockers will not interfere the absorption of these medicines even if we have taken food or even meal. Okay, and what is the most important thing you have to teach them? We should not allow them to chew or to crush the medicine. Kasi nga, these calcium channel blockers are sustained release or kanang mga SR kanina to ng mga tambal. Okay? Because these medications are intended to be dissolved inside our stomach. Okay? With the help of our gastric contents. Okay? Dili kay sa bakbak. It should be inside our stomach. Okay? So, take note of this. When taking calcium channel blockers, okay, remember VND. Okay, VND, your very nice drugs, your verapamil, nifedipine, and diltiazem. Okay, and the action of these calcium channel blockers is what? It decreases heart contractility, it decreases conductivity of your heart, and it decreases the demand for oxygen. Okay? Ma'am, kung mag-decrease ang demand sa oxygen, dili ba hypoxia imong patient? Dili man pod sa mawad-an na siya og oxygen. I-decrease lang natin. Okay? As a compensation to the existing problem of your patient. Okay? So the side effects of this medication, there will be a decrease in blood pressure. There is bradycardia. Kaya nga dapat monitor your patients' vital signs. May precipitate AV block. Okay, there will be headaches, abdominal discomforts, and of course peripheral edema. Okay, and then we have talked about all of the managements that you have to do with these patients. Okay, so now let's proceed to our vasodilators. So when from the root word dilator, okay, pampadako. Pampadako og unsa, pampadako og ugat. Okay? Ugat lang. Okay? Dili na og laing pangbutang. Okay? Kay mura pug ako ang mga estudyante kagahapon, pampadako og unsa, pampadako og ulo. Okay? So vasodilators, action is to relax the smooth muscles of the blood vessels, especially our arteries. Okay, this is to promote what? Increase blood flow in the brain as well as in your kidneys. Okay, so doctors usually prescribe vasodilators to patients who have severe hypertension. Okay, and then emergency situations such as kanang mga heart failure, and then kanang mga pregnancy-related problems such as your preeclampsia and eclampsia, and as well as your mga pulmonary hypertension. Okay, we are giving these vasodilators. So example of this is your hydralazine, minoxidil, diazoxide, and nitroprusside. Okay, pinaka-common na makita ninyo sa emergency cart is this hydralazine. Okay, naagid ni always sa mga emergency cart. Okay, and then our vasodilators, okay, work directly on the vessel wall. Okay, ang example sa kanang mga tambal na nag-work directly yun sa ato ang vessel walls is our hydralazine and our minoxidil. Okay, maugid ni siya. So what are the side effects of these medications? Okay, for hydralazine, okay, actually same lang siya. Okay, na ay tachycardia. That's why we are going to give patients with beta blockers. Common also is our palpitations. Kapag our patient is experiencing edema, we are giving them diuretics. Okay, headache is also tawag ani kanang common. Dizziness, GI bleeding, lupus-like and neurologic symptoms. Kung sa'y pasabot aning lupus-like, ma'am, magka-lupus imong patient? No, but they will be experiencing some tawag ani kanang symptoms like a person who is experiencing lupus, like naa siya mga joint pain and stiffness, mga rashes sa face, okay, feeling of kanang tiredness, kana siya, loss of appetite, common pod ang kanang mga tawag ani kanang weight loss, okay, kasi nga syempre there is already loss of appetite. And then as a neurology symptoms, common ang patient na maka-experience og kanang mga numbness and tingling sensations as well as kanang itchiness sa ilahang skin. And okay, these medications can what? Can lead to feeling of depression and anxiety. Alam ma'am, kahadlok ani nga tambal ma'am boy. That's why, okay, when you are giving this kind of medication to your patient, it is really advised to monitor your patients. Not just the effect, but as well as the sensorium of your patients. Okay? So, same lang siya of effect, or I mean side effect ang kanang hydralazine, minoxidil, and meropenicillin. But, okay, anong pinagkaiba lang nitong tatlo? Your minoxidil, okay, ang makabalugyog ka na, your patient is taking minoxidil because once a patient is taking this kind of medicine, there will be excessive hair growth on your patient. Okay? And, di ba, kung imuhang tanawon ng mga products that are what? Mga hair growers, labaw na kanang sa mga nangapanot, na? Unsa ang ilahang mga main component sa ilahang mga hair growers? That is minoxidil. Okay? So, minoxidil. But, okay, be careful lang po ta sa paghatag o ato ang mga minoxidil because this could precipitate chest pain. Okay? So what are the contraindications of this medication? It is contraindicated, of course, to patients who have allergy. Kasi we don't want to have hypersensitivity reaction related to your vasodilators. Okay? It is contraindicated to pregnant and lactating mothers because they could what? Pass through our breast milk barrier. Okay? So, pwede siya mag-cause of problem sa ating mga babies. Okay? And pwede po siya magkaroon of problem, okay, or cause of problem sa atong moms. Okay? Pwede magkaroon kidney failure ang inyong mom. Okay? So, that's why that we really don't encourage these medications to be taken to our patients who are pregnant and lactating. Okay? Cerebral insufficiency. Okay? Kasi nga, our patients who have cerebral insufficiency might get worse. Okay? Might have worsened their situation once they are taking vasodilators. Kasi nga, di ba, ang function sa ato ang vasodilator is to lower the blood pressure. And then if there is already cerebral insufficiency, kulang na ang blood supply sa utak, imuha pang paimnon og vasodilator, pwede mag-comatose imuhang patient. Okay? So, it should not be given, okay? I mean, the drug interactions, okay, our vasodilators, if we are going to give it, okay, like what I have said kanina, we are going to give it to our patients and we will incorporate it with another type of antihypertensive medication, we will be resulting into an additive effect. Okay, and we know that if it is an additive effect, okay, we will be expecting a faster and a more potent type of medicine. But okay, this kind of tawag-an ni kanang combination of drugs should not be applicable to all. Kasi nga, we have to consider also the present condition of your patient. Kung wala ba silang mga kidney problems, liver problems, which is essential for the metabolism and excretion of drugs. Okay? So, what are the nursing considerations for patients taking vasodilators? Remember the mnemonics dilator. D stands for directly act on vascular smooth muscles. Yun ang effect ng ating vasodilators. It increases renal and cerebral flow, okay? Because it will dilate our vessels. L, lupus-like reaction. So the patient will be experiencing some lupus-like symptoms, fever, facial rash, joint splenomegaly, and muscle and joint pains. Assess your patient for signs of peripheral edemas, and if it happens, elevation is one of the key things that you have to perform to your patient. Take it with food, okay? There's no problem, okay? If you're going to take this with food, because the absorption will not interfere even with there is food. Your other side effects include your headache, your dizziness, your anorexia, increased cardiac and decreases blood pressure. That is still things that you have to consider. And of course, you check your patient's blood pressure, because if your patient's blood pressure is already low, okay, we should not give vasodilators kay magsamot og ka-hypotensive ang imong patient. Okay? So do you have any questions? Do you have any questions, clarifications, violent reaction? Oy, noon na to. Oh, ano na? Meron? Wala? Ma'am, wala na, din lang mo istorya ma'am kay kanang kapoy na ma'am. Okay, if you don't have any questions, okay, I will be posting the video, okay, on Quipper, and then of course expect a quiz, okay, on our next meeting. And actually, before I forget, I want you to have an assignment. Okay, this is still part of your another kind of medications for antihypertensive. These are sympatholytic medications. So I will send on the GC, okay, the format as to how you are going to do it. Ano siya pakita sa Thursday po? Ano siya pakita sa Thursday? Hoy, Bing, unsay pakita sa Thursday? Unsa kung pakita?
Wala ma'am, gimingaw lang minimum ma'am.
Serang frag mura jud.
Ayun na sa front ma'am.
Wa man gani ka nang pupeng kam kahon.